Hi guys, today we're going to talk about reasons to go see your OBGYN. I usually run into patients that have never visited a gynecologist until they're pregnant. One of the first reasons to go see your OBGYN, of course, would be to start prenatal care because you just found out you're pregnant or your period is late and you think you might be pregnant. That's the perfect reason to make an appointment with your OBGYN. Maybe you're not pregnant yet, but you're planning on getting pregnant or you're trying to get pregnant. You shouldn't really wait until you are pregnant to see your OBGYN because your OBGYN might want to start you on prenatal vitamins if you're not already taking them, or they might want to screen you for genetic problems or any medical problems that can be treated and managed before you actually get pregnant. For example, if you're diabetic, you want to make sure that your blood sugar, your glucose is under control and it's normal before you get pregnant, because a lot of diseases can cause problems with the actual pregnancy. There are certain medications that have to be switched so that you can take them when you're pregnant. And of course, by the time you find out you're pregnant, you might be already like 6-7 weeks. You've been on the medication that we want to avoid for a couple months. So if you're planning a pregnancy, great time to go see your OBGYN. Another reason is maybe you're trying to not get pregnant. So if you want to start a birth control method, you had a protected sex and you need plan B, or you want to switch your birth control method, these are also great reasons to go see your OBGYN. Another good reason to visit your gynecologist is if you're having any vaginal discharge or any signs that you might have an infection and you want to get screened for either vaginal infections like bacterial vaginosis or candidiasis, or a yeast infection, or if you want to get tested for sexually transmitted infections. Great time to go see your OBGYN. There's certain tests that we do in the urine, there's certain tests that we do by swab, and then there's those tests that we do in the blood. Check all these things. When we get the results, we call you, give you treatment if you need it. Otherwise, we recommend getting yearly STI checks if you're 25 and younger. Over 25, only if needed, if you know that you've been exposed or if you know you've had multiple partners, and if you need it, of course, we're happy to test you. We recommend yearly testing for those at high risk. If you've never seen the OBGYN and you're probably like, oh, there's nothing wrong with me, I don't have to see my OBGYN. Well, actually, we recommend that everyone who is between the ages of 13 and 15 go to the gynecologist for the very first time, because you can just educate yourself about your body, find out what's normal and what isn't, what changes to expect that come with age. Maybe we can get a baseline of what your health is, and your gynecologist can help guide you as to what to expect in the future, or what tests you should be doing routinely when you start doing your Pap smears, your breast exam. Get familiar with what your normal breast feels like, so that if something changes, you will be the first to notice, and then you can come back and let us know so we can work it up. So along with going to the OBGYN between the ages of 13 is to get your Gardasil vaccine. We recommend it to girls 12 to 26. You can go to the OBGYN or your primary care doctor actually to get the Gardasil vaccine that protects against HPV or the human papillomavirus. The sooner you get it, the better. The goal is to get it before you start your sexual activity, so by the time you are exposed to the HPV virus, you're already protected against the more common subtypes. Another perfect reason to go see the OBGYN is because you're due for a Pap smear. The Pap smear is a screening test for cervical cancer. We usually recommend start checking your Pap smears at age 21 regardless of your sexual activity. So even if you've never had sex before, at age 21 you should start getting your Pap smears. And we recommend getting those usually every 3 years. If they're negative, if they're not abnormal, if everything is okay with them, then usually every 3 years you should be getting them. Another reason to see your OBGYN, if you are 14 years old, you don't have any breast tissue at all, no budding, nothing, or if you don't have any pelvic hair at all. At age 14, you should probably have it. So this is a great reason to go see your OBGYN so that they can, find out what's going on. If you are 16 years old and you've never had a period, you're up there at the age where you should at this point have had a first period. Make sure you make an appointment to go see your OBGYN so you guys can figure out what's going on and what's causing this. You should also go see your OBGYN if you have very painful periods, if you have really bad cramps. We're so used to people having cramps that we think it's normal. Actually, it's not normal. You shouldn't have to suffer through your periods, you shouldn't have really bad cramps, definitely go see your doctor, see your OBGYN so they can help you and you don't have to suffer through your period. Painful periods are associated with this condition called endometriosis. It is so common. It's so prevalent, but people don't realize it because we're so used to growing up with everyone in our family having painful periods that we think it's normal. And another reason to go see your OBGYN is if you have very heavy periods. If you have to use 2 pads at the same time, that's way too much bleeding. You probably have low blood count, anemia. All right, you guys, so these are some of the more common reasons why people go see their gynecologist. Make sure you like the video, subscribe to our channel, and like us on Facebook. And if you have any questions, I'm happy to answer them at gynogal@gmail.com. Leave any comments down below. Thanks, see you next week. We are referring to is the pill. So the main reason that most women go on birth control is for pregnancy prevention, of course. Another reason to go on birth control is to make your periods regular. So there's some women who get their period too often, like every 2 weeks, or maybe their period lasts longer than a week.